adjustment as to what is needed. But Minister, it's a whole area that needs massive change, and we can have all the regulations and healthcare amendments bill, professional health social care amendments bill, and we can have all the grandiose titles and of course amendments, and indeed the memorandum and the bills, everything else, but services is what people want out there. You know that. Any talk to Donna, living in any constituency knows that it's the services and the people, the healthcare professionals, to deliver those services in a professional and timely manner. And in some cases, unfortunately, in all cases, or most cases, they're not timely. But in some cases, unfortunately, the profession is questioned as well. And we heard the second last speaker talk to Tobin. That's not the first time I've heard that. I've actually discussed it with him. And we all have cases where people are languishing on waiting lists for professional therapy and help, and indeed from the cradle to the grave, literally. But it's most troubling, when it's young people that are trying to get assessments, that have peculiar and special educational needs, and indeed language needs, and all kinds of therapists, and they can't get them. And that's where the real problem is. So we can have all the pieces of legislation and all the aspirations and flowery, as I said, words and sentences and acronyms, but if we can't get the services. And there's nothing more frustrating for a family, for parents, whether it be one parent or two parents or a whole family, and siblings, when there's children with special needs and additional needs, special needs, but needs that are not even determined because they can't get access, to the professional services that they require. And indeed, the life could change, and the family's life could change with diagnosis, and indeed with additional supports. And that's it's more and through a shin, because and then we can go on, to the whole areas of autism and dyspraxia, dyslexia, you name it, ADHD. And my late brother was a paediatrician, and quite a good one, is what I hear from his patients. And he had a keen interest, I rest him, in especially children with learning difficulties and with any kind of needs. And he had travelled the world, and he had gained some expertise. But look, I still meet families today, and I thank them. It's nice to meet them, to come up to me and say that they miss him so much, 11, 12 years on. And first of all, the patient must be the centre, no matter whether it is young or old, of our healthcare system, and unfortunately it's not. And it's regressed seriously since that dreaded COVID, and and a lot of services haven't, and people are not back to working places, and the skeleton services, and they're working from home or whatever. I'm not here to undermine and challenge all the staff. There's some great people working in the HSE and these other care areas, and indeed mental health. But there's some amount of cracks, and there's some amount of needs, and there's some amount of trauma and anguish. And when we see people today up lobbying from the music and entertainment industry, and a very, very special lady, her name eludes me now, who gave us a rendition of a Conor Gar Cancola in the AV room, and a bit of recital as well as to why people like her are punished. The system is cruel to them. It isn't their disability, it's their ability we must be praising. Mullen O'Gee Chucky Sheet, Mullen Nadina Chucky Sheet. It's their abilities we must, what they can do, not what the horrible word, I suppose, disabilities. So there's a huge area here for learning, and a huge area here for, excuse me, for brushing up on what we do, instead of the slippage that we've had. And can I just say, I met a retired person recently used to look after the home care hours and the home care applications, and she's retired. And she just said to me, Mattie, I'm delighted to be gone, because no problem to get home care hours now on packages, but we have nobody to do it. And the flight of expert people But first of all, they're expert in their own right, and they don't, many of them don't have any degrees, but they have a degree in understanding and care and passion and supporting, in that, Kayla, supporting people who are sick. And indeed the carers, and I always wear the carers badge, but it's covered up with the mental health badge this evening. And the mental health budget minister, we have questions about that as well. We met to people today, and in downstairs as well, lobbying. And I suppose with a proper system, these people shouldn't have to be lobbying, but unfortunately they have to lobby. And maybe it's the bigger organisations and the more powerful ones that can lobby strongest will gain, get the best outcomes. But look, unfortunately, the carers and the home care packages, and it's so short-sighted. Well, I know, look, it's easy now with the announcement of all the monies, and the Taoiseach will anyway question them or tarnish our minister that there's so much additional budget, but they're not there. And they're ran ragged, and they're tired. And the distance now travel with cost of fuel and everything else, and the impacts that they make, the joy that they bring to people in their homes and their home care visits, and indeed they're keeping them out of hospitals, keeping them out of A&Es, and it really needs to be a total overhaul, and to put more into community services. And this bill, I hope, should be about enabling that, but it's not happening. And we see it in the nurses. I met a nurse recently who told me that 67% of her class were in Australia. And they have done so much learning here and done so much to get that wonderful, noble profession of being a nurse, and indeed then to immigrate. And we know that the growth is there for some people who will immigrate anyway, and they want to travel. But
I'm going to have to interrupt you now.
Oh, and I'm just going to step in the travel, Count Cola.
Which you'll have another room.
Count Trust quick now.
You'll have 12 minutes and 33 seconds.
Go on,